Hello and welcome to another edition of Health Sense, supported by Glen Eagles Hospital on your side. I'm Glenn Ong and he's the Flying Dutchman, and this month's theme is in line with the holiday season and things to take note of while feasting and traveling.
Now, you know that Health Sense is a monthly series where we talk to a collective of medical and wellness specialists about a wide range of different health matters.
Up next on Health Sense, we have a cardiologist from Glen Eagles Hospital, Singapore, Dr. Daniel Yeo. Good morning.
Hi, good
Thank
morning.
you. Thank you so much for joining us. The year-end season is also a time for festive feasting. It's time for celebrations, lots of late nights. We're partying, we're having fun. Some of us may have underlying heart problems. Overexcitement can actually lead to some pretty disastrous outcomes as well.
Yeah, but before we get into that, I think there is something that we need to address.
Yes.
And recently, a well-known personality, Godfrey Gao, passed away. Was it a heart attack or a cardiac arrest? I'm not too sure. But is there a difference, doctor, between a heart attack and a cardiac arrest?
Well, certainly it was a tragedy. I mean,
It was.
Godfrey was young man with so much ahead of him.
And he looks so fit and
course.
He was
yeah.
35, if
Exactly.
I'm not mistaken.
Yeah, I think he's younger than all of us here, right?
Yeah, definitely.
Yeah. So, I mean, we don't want to comment directly on this case, but certainly some of the reports suggested that there was cardiac arrest. And there is a difference between cardiac arrest and heart attack. Of course, a heart attack can cause cardiac arrest, but the heart can actually go into what we call cardiac arrest, which just means it stops beating. It doesn't necessarily need to be a heart attack. A heart attack is where the blood vessels in the heart get blocked up. So if I can take a model of the heart.
Right.
So this is a model of the heart. It's enlarged. That's not the size of a human heart.
Thank goodness.
That'll be the size of Goliath.
Yeah.
So you have the heart, which is mainly a muscle to pump blood around the body. And the muscle, of course, needs blood supply to bring oxygen and nutrients to the muscle for it to work. So you have three main blood vessels, one on the right side and two on the left. And if any of these blood vessels get blocked up, and usually by cholesterol, and that would cause death of the heart muscle, and that's a heart attack. So usually people will feel chest discomfort or chest pain, sweaty, they may even feel faint or collapse. A cardiac arrest can occur in the setting of a heart attack, but sometimes there are other conditions, so such as irregular heart rhythms, which can lead to the phenomenon of cardiac arrest. Certainly with a flu-like illness, that can cause what we call viral myocarditis. That's inflammation of the heart muscle, and the heart muscle can also weaken or even have an irregular rhythm and eventually go into arrest.
Okay, with cardiac arrest, can it just be that the person gets so worked up that the heart just can't take it anymore?
Well, it would need to result in the heart actually stopping.
Yeah.
So there would be a few different possible mechanisms. We talked about heart attack, we talked about irregular heart rhythms. Of course, there's this entity called the stress cardiomyopathy or Takotsubo syndrome, and that's been increasingly recognized. It was first described in the 1990s by the Japanese, but we realized that it's not a purely East Asian phenomenon. It's in Singapore, in Southeast Asia, in the West as well, and in fact some of the largest case series have been reported in the US. And what happens is that there is no blockages of the blood vessels, but the sudden surge in stress hormones causes the heart to malfunction. And what happens is that the base of the heart, so if we open up the model of the heart here, if I can show you this. So this is the main pumping chamber of the heart. The base of the heart contracts forcefully, but the rest of the heart, instead of contracting, just balloons out. And that's why they call it the Takotsubo syndrome, because that's the name for the octopus pot that the traditional Japanese fishermen would use to catch the octopus. And it looks like a balloon. So that is another condition that is recognized to result in a sudden situation where the heart can actually malfunction, weaken, or even stop. So it's possible.
This is also, it's also been referred.
That's literally, I mean, as someone who suffers the Takotsubo syndrome and who passes on, it's literally dying of a broken
heart.
Exactly.
That's
one of the other names.
The other names for it, right? The broken heart.
Yes. And what we've realized is that it is quite unusual because a lot of the precipitants are emotional. So someone can have a sudden emotional stress. You know, if you watch the show Saving Private Ryan, where the lady received news that 3 of her sons had, given their lives. You know, in that situation, such a person could theoretically develop this broken heart syndrome.
Yeah.
And we find that the majority of people who develop it are women, and most of the stresses are emotional. But there are also physical stresses that we have realized in our studies that some people do experience physical stress and result in this condition.
Or it could, as you said, it could just be the shock of something.
Of a sudden bad news.
Bad news or something that causes it.
Right.
Yeah.
But just getting back to Godfrey Gao, we were talking about him early on. What do you think happened?
Well, it sounds like it was a combination of factors. So in a sense, a perfect storm. He may already have had a underlying heart condition. Maybe it wasn't so severe, but it was allowed to manifest because apparently he was overworked. He was working very long hours, 17 hours a day. He was recently having an illness, a flu-like illness.
Right.
So all that probably contributed to make his heart more sensitive. And when people are under stress and they're working overly long hours and trying to perform, obviously what do? You drink lots of coffee, maybe you take lots of Red Bull. So those are stimulants.
Right.
And those also increase the chance of the heart developing irregular rhythms.
So here's the question, and you mentioned this a little earlier. So let's say I have the flu. Is it true to say that I should not be overexerting myself, I should not be exercising? Because there are people who say that that virus can then travel directly to your heart.
Yeah, absolutely. So I think if you have a flu, if you are unwell, then you shouldn't be participating in competitive sport. You shouldn't be pushing yourself. It doesn't mean you have to lie in bed.
Right.
You know, you can still walk and so on, but you shouldn't be really exerting yourself. So if you are planning to go for a jog, postpone it. Your life is much more important than keeping to that schedule or reaching that target.
Very important advice.
Yeah, I remember growing up and hearing my friends talk about their parents asking them to run around when they're having a fever to break the fever and all that. So
because if you sweat, you'll break the fever.
Yeah. Well, the phenomenon of sweating actually is a result of your body getting better. So it's not that you force a sweat. When you are ill and when you have a fever, what's happening is your body changes its set temperature. So let's say your normal body temperature is 36.5 degrees. When you are ill, your body says, okay, your normal temperature should be higher. It automatically increases the temperature. That's why you have a fever, but you're not sweating.
Right.
But when you're recovering, then that set temperature comes down again. And then your body detects, oh, now I'm hot, so I start perspiring.
Oh.
Yeah, so you can't force yourself to get better.
Right, okay. Oh, let's talk about something else. I wear it. I know a lot of people wear it. Wearables.
Yes.
I've seen things now that they track your heart rate, they track your blood pressure, they track all kinds of things. Are these things really good, or do they just stress people out even more?
Well, I think yes to both of that. So It depends on the individual. So you have to be aware of what you're trying to achieve. If you are exercising and you want to know how fast your heartbeat goes to,
right.
or if you have a certain timing you want to meet, that's very useful because now you can have a very portable device. It's very accurate and reliable. But on the other hand, if you're trying to worry about your health and you're going to look at your device constantly and wonder if every little blip means that a heart attack is coming, that's going to cause more psychological anxiety. And you shouldn't have that device then.
Interesting that you said these devices are actually accurate. So the heart rate monitors are actually accurate.
They are accurate, yeah. So
what about the newer ones that have blood pressure? Blood pressure is always taken off the arm. Now suddenly we're taking it down on our wrist.
Yeah, so that's an interesting question because that's technology. When we measure the blood pressure, it's a very old technology,
right.
more than perhaps 150 years old.
Okay.
And that just relies on occluding or blocking the blood supply.
Right.
And then measuring that pressure required.
Right.
But the new way of measuring blood pressure requires measuring the pulse wave characteristics.
Oh.
And so you don't actually need to compress the artery fully. Of course, that is not a direct measurement of the blood pressure. It relies on a database of so-called normal values and abnormal values, so they develop an algorithm. So it depends on the device itself. Some are very accurate, but of course they could be cumbersome. And then you have the very portable ones that at least there is one or two locally that are fairly reliable, and some of the international experts do endorse. And then of course you have a whole plethora of others that may not be as rigorously tested.
Yeah.
The technology is amazing.
It is amazing. It is amazing.
New technology.
Yeah.
Now, Doctor, we've been talking about the festive season and celebrations during this period. Can this lead to holiday heart syndrome? And what is holiday heart syndrome?
Yeah, so when we talk about holiday heart syndrome, it refers to taking too much alcohol too quickly.
Okay.
So alcohol is a toxin, it's a poison, and I mean it does have some psychogenic effects that can be pleasurable in moderation. But in excess, of course, we can't metabolize that poison fast enough. It's going to affect our organs. And one of the organs it can affect is the heart. So if you take a lot of alcohol at once, that's a binge, the heart can actually go into an irregular rhythm called atrial fibrillation. So it's very common in, for example, younger people who are experiencing alcohol for the first time. They're not sure how to control and they take it to excess. And of course, I mean, it may not be just confined to younger people. So that is something that is quite scary because they suddenly have palpitations, they may feel dizzy, they may even faint. It's unlikely to cause death straight away, but it's a sign that they have to, they've taken too much, they need to, cut down or stop. Yeah.
We got to stop drinking.
Everything in moderation.
That's right. Of course, depends on your definition of moderation.
Of moderation, yeah, it's true. No, I drink, and when I feel happy, I stop.
Okay.
I've got a limit. I can't get to a point where, and I haven't done this for a long time, where I actually throw up. That's not good.
Thanks for that, FD.
Sorry about that, Glenn. What actually happens to your body during a heart attack?
So when a heart attack happens, and that's when there is a blockage of blood flow to the heart muscle, the heart muscle detects that, you feel pain. It's just like a stitch. If you're jogging and you haven't jogged recently, you feel a stitch in the side.
Yes.
But that's not dangerous. But if you feel a stitch in your heart, then that means that there is some danger. So you feel pain or discomfort, you will start to have elevation in the blood pressure because stress hormones are being released, and as a result, you start to perspire. You may feel faint and dizzy. If the heart malfunctions, then you may feel breathless.
Right.
And then if it goes in an irregular rhythm, of course, you feel palpitations. You may even faint. So that's the symptoms that people experience. Of course, if there is severe impairment of blood flow, then the other organs can be affected. So we talked about fainting, but also it may cause organ shutdown of the other vital organs like the kidneys and the liver.
Right. Okay, I had my heart attack, 6 years ago?
Oh.
Yeah.
About 6 years ago. So I got the pain in the chest. Tell me if this is right or whether I'm remembering it wrong.
And he refused to go to the hospital.
I was playing Superman.
Yeah.
But on Sunday, the pain went from the chest up my neck and into my jaw. Is that part and parcel of what would happen?
That's right, yeah. So you're describing the classic textbook description of chest pain from a heart attack. Of course, you have the chest pain, but because of the way your inner nerves are wired, you may get pain going up into the neck and the jaw, and some people even feel pain in the teeth.
Right.
And also pain down the shoulder, usually the left shoulder, down the left arm, sometimes on the other side, but usually the left side. Some people feel discomfort in the abdomen, the upper abdomen, or even nausea, so they may think that's just food poisoning and just ignore it.
Right. Are the symptoms different for men and women?
So this question is quite common. Basically, men and women actually do experience the same symptoms, but to different frequencies. So, of course, women can also have the classical signs of chest discomfort and pain going up the jaw, but more often they have what we call atypical symptoms. So it's quite chauvinistic actually. So typical is male and atypical is female.
Okay.
So you have the abdominal discomfort, they may feel palpitations, heart beating fast, sweaty or breathless or dizzy. So these are all the other signs and symptoms of a heart attack that males can experience, but maybe women talk about it more. I think the more important thing is that women, when they have a heart attack, they tend to do worse than men. And that's for, one of the reasons is that the symptoms are not recognized as being what it is. Even for yourself, you're quite resistant to seek help.
To me it was like, oh, don't worry, this will go away.
Yeah, for a woman it's even worse. So, firstly, the symptoms are not classical. Secondly, maybe women are more focused on the family. I have had a patient in the past, I recall she was around this season and it's going to the Lunar New Year as well. So of course a lot of homemakers will be looking after the home, cleaning the house, and then she had symptoms, she ignored it until she couldn't take it anymore. She came in, she really had a heart attack. So that was too late. So when there's a heart attack, you need to come into hospital as soon as possible because time is muscle. So the longer you delay, the more heart muscle is damaged and there's less muscle that we can salvage or save.
Yeah, that's very interesting. That expression is interesting because that's exactly what my cardiologist told me. Time is muscle.
Yeah, better to be safe than sorry.
Exactly. Yeah.
So if you go down to the hospital and you're not really having a heart attack, but you think you are, I mean, the first thing they'll do is an ECG.
That's right, yes.
And how can the ECG tell if you're having a heart attack or not, or you're someone at risk?
Yeah, so basically ECG is a very useful test. So the type of heart attack that we have to act on immediately is one where there is a complete blockage. Of course, there could be various degrees of severity of heart attack. Some are just minor narrowings, some are just partial blockages, but the severe situation where there is a complete blockage needs an emergency procedure. So that is very clear on the ECG. We can see that. Some heart attacks are very minor. There may not be any ECG changes. Then you have to do blood tests to see if there's any damage to the heart muscle that will be shown up in the test as raised levels of certain enzymes.
Wow.
Right.
That's really
A
interesting.
few years ago, I thought I was having a heart attack.
Yeah, we all did.
After a heavy night of drinking. So I woke up the next morning and I felt like I was having a heart attack. So I rushed myself to the hospital. Right. And I looked at the nurse and I said, I think I'm having a heart attack. She smiled. I think she knew that I wasn't.
She probably knew it wasn't.
So I went in there, I did an ECG. She's like, you're fine. There's nothing wrong with you. But hey, better safe than sorry,
of course.
Right?
Absolutely.
I've got a question here from one of our viewers by the name of Ling Chi, who asks, does heart palpitations due to anxiety or panic attacks affect the health of our hearts in the long run?
It's a good question. I mean, the heart actually is designed to take a lot of stress and wear and tear. And all of us have extra heartbeats or irregular rhythms on and off once in a while. Of course, if those irregular rhythms become persistent, then that becomes a problem. There is a study looking at the burden of what we call these extra heartbeats or palpitations. And of course, statistically, the more of these irregular heartbeats you have, then the more likely the more likely there will be a true cardiac condition later. Whether or not it's just an early sign of some underlying disease or whether it's a total effect of the burden of palpitations, we don't exactly know. But certainly the burden of the irregular rhythm is correlated with later diagnosis of heart disease.
Right. Now, doctor, for someone who runs quite a bit and goes to the gym and all that, how much is too much when you're working out? With the wearables and all that, we can always monitor, and with the equipment, we can always monitor our heart rate.
My question to that though, Glenn, is do you know what your maximum heart rate should be?
Yes,
we can monitor it, but do we know?
Exactly.
It's 220 minus your age.
Absolutely, yeah.
Right.
So it's just an arbitrary number, but it's fairly reliable. So you just take 220 minus your age in years, and then that is your so-called maximum predicted heart rate.
Yeah.
It doesn't mean that if you go beyond that, something bad will happen,
Right.
but it's just a marker, and what we are using that for is certainly for some diagnostic tests and also to know how hard to push yourself.
Yeah.
So if you're just exercising for health and fitness, then what you need to do is aim for 60 to 70% of your predicted maximum. If we are doing a stress test, for example, we push you to at least 85%
Right.
to 100%. So the more stress, the more accurate. If you're an athlete, you're a competitive athlete, then you would have higher goals than that. But just for fitness, 60 to 70% of your predicted maximum heart rate for 30 to 45 minutes, 3 to 4 times a week. Not too much.
Okay, so a person like me, I've had a heart attack. Do I still use the same calculations?
Yeah. So I assume that you've recovered now. You look very
Yeah.
well. I
Yeah.
didn't know you had a heart attack,
Yeah.
but so you have a very good cardiologist. After a heart attack, you need to undergo a period of exercise,
Yes.
what we call cardiac rehabilitation, to ensure
Yeah.
that you can restart exercise safely. And once you're stable, then you should be able to resume normal exercise. It also depends on how much of the heart muscle has been damaged. So someone with a very severe heart attack who's had significant portion of heart muscle damage may have heart failure. And of course, for those people, the exercise targets are different.
Right. We raise his heart rate every morning. When
Every morning.
In a good way, I hope.
I have listeners going, are you feeling all right? Are you okay?
They're looking at their Fitbit.
these
And I just
arguments.
go, nah, yeah, I'm okay. No worries.
We have been speaking to Dr. Daniel Yeo, cardiologist at Gleneagles Hospital, Singapore. Thank you so much, Doctor.
Thank you.
Thank you so much.
Today.
Thank you.
Good times.
Greatest hits.
1FM 91.3.